The safety benefits of dabigatran are established in clinical studies and in real life. But despite the safety benefits, there are still patients who present with bleeding. The availability of a specific reversal agent that promptly reverses the anticoagulant activity of dabigatran without any other effects on coagulation is expected to be an additional tool that helps clinicians to manage these patients. Well, let me tell you about a patient that we've recently treated with idarucizumab. It was a patient, an 83-year-old woman, who was treated with dabigatran for stroke prevention because of atrial fibrillation. And actually that lady did very well. She tolerated the treatment very well. The 83-year-old lady was known with atrial fibrillation, which is a common heart rhythm disorder that increases the risk of stroke because blood clots are formed in the heart. Patients with atrial fibrillation mostly require anticoagulation to prevent these clots from forming and hence to prevent strokes from occurring. On a certain day, a few hours after she took her dabigatran, there was a fall in the bathroom. It was a simple fall, but with a complex result. Actually, she had a very complex injury, an open fracture of her lower limb. In elderly, frail patients who are on anticoagulation, these traumas are not uncommon. Mostly they can be managed conservatively just by waiting, or mostly surgery can be postponed a few hours. But here in this patient, it was really a very complex fracture, and the orthopedic surgeons were clear that immediate management would be clearly the best option for that patient. So when a patient arrives at the hospital with an obvious complex injury, there are some standard measures. You will perform some lab testing. These lab tests may actually confirm that she recently took dabigatran. Because of the short half-life of dabigatran, it's 12 to 17 hours in most patients. When you respect a time window of close to 24 hours after the last intake, there is only limited residual anticoagulant activity that does no longer interfere with most of the procedures. Exceptionally, surgery needs to be done right away. And these are the patients who are perfect candidates for administering the reversal agents and going forward with emergency surgery with the shortest delay possible. In an anticoagulant patient who requires surgery, bleeding is an obvious concern. There are other measures that may support hemostasis, such as the use of coagulation factors, the prothrombin complex concentrates. However, these are hemostatic measures that have a certain thrombotic risk associated with it. Idarucizumab is a reversal agent that specifically binds dabigatran with high affinity and thereby neutralizing the anticoagulant activity of dabigatran. What is important for emergency room physicians to know is that it's not only immediate and complete and sustained, it's a simple administration of 2 vials of 2.5 gram of a dose of 5 gram that is administered within minutes. For this patient with a complex open fracture, surgery without any further delay was considered to be the best medical treatment. And because idarucizumab was administered, we were able to neutralize the anticoagulation and also, importantly, to reassure the anesthesiologist, the orthopedic surgeon, that they could proceed with immediate surgery and that dabigatran and its anticoagulant activity was neutralized, was taken out of the equation. The patient received the surgery, there was uncomplicated postoperative follow-up. We reinitiated dabigatran after a few days. Dabigatran was continued to protect that patient for stroke, and actually, because we had the reversal agent, the patient and the family members and the GP were actually reassured that it was a good thing to continue anticoagulation. Iduricizumab is an important further step forward. It closes the circle. We now have dabigatran in these exceptional circumstances where reversal is needed. Iduricizumab is standby for the prompt reversal of the anticoagulation. And importantly, a reversal agent will also improve the confidence in the use of dabigatran and hence help the more appropriate management of patients with atrial fibrillation, protecting these patients against stroke.